intercostal space, intercostal nerves and vessels. Intercostal nerves. The intercostal nerves are the anterior primary rami of thoracic spinal nerves. There are 11 in number on each side. The anterior primary ramus of the 12th thoracic spinal nerve runs below the 12th rib, hence it is called subcostal nerve. Classification. The intercostal nerves are classified into two groups. Typical intercostal nerve. They are confined to their own intercostal space in the thoracic wall. Third, fourth, fifth and sixth intercostal nerves are the typical intercostal nerves. Atypical intercostal nerve. They extend beyond the thoracic region and partly or entirely supply the other regions. The first, second, 7th, 8th, 9th, 10th and 11th intercostal nerves are the atypical intercostal nerves, which supply abdominal wall along with thoracic wall. Typical intercostal nerve. Course. The thoracic spinal nerve, as soon as it leaves the intervertebral foramen, it divides into anterior and posterior rami. The anterior rami is nothing but the intercostal nerve. After its origin, it passes behind the sympathetic trunk and then enters the intercostal space. In the posterior part of the space, it lies between the pleura and posterior intercostal membrane. The nerve then passes below the neck of the rib and enters costal groove of the corresponding rib. In the costal groove, the nerve comes in relation to corresponding intercostal vessels. The arrangement of structures in the costal groove from above downwards are vein, artery and nerve. At sternal end of intercostal space, it passes in front of the internal thoracic vessels and the sternocostallis muscle. It then pierces the internal intercostal muscle, the external intercostal membrane and the pectoralis major muscle to terminate as the anterior cutaneous nerve of the thorax. Branches. Muscular branches. Numerous small branches arise and supply the intercostal muscles and serratus posterior and superior. Collateral branch. It arises from the posterior part of intercostal nerve near the angle of the rib. This branch runs in the inferior margin of intercostal space in the neurovascular plane. It supplies intercostal muscles. Sensory branches. Collateral branch. Along with main branch, it supplies the parietal pleura and periosteum of the rib. Lateral cutaneous branch. It also arises from the posterior part of intercostal nerve near the angle of the rib along with the collateral branch and runs with the main trunk for a small distance. Then pierces the muscles of the lateral thoracic wall along the mid-axillary line. It divides into anterior and posterior branches. The The posterior branch supplies the skin of back, overlying the scapula and latissimus dorsi. An anterior branch supplies the skin overlying the pectoralis major muscle. Anterior cutaneous branch. It is the terminal branch of the nerve. It emerges by the side of the sternum and divides into medial and lateral branches and supplies the skin on the front of the thoracic wall. Communicating branches. Each nerve communicates with the corresponding thoracic sympathetic ganglion by white and gray rami communicants. White rami communicants carry preganglionic fibers from thoracic spinal nerves which are derived from lateral gray column of spinal cord. The gray rami communicants are proximal to white rami communicants and carry postganglionic sympathetic fibers from sympathetic ganglion to thoracic spinal nerve. These supply the sweat glands, arrectoris, pylorus, and smooth muscle cells of blood vessels. Atypical intercostal nerves. First intercostal nerve. It is the smallest intercostal nerve. The greater of this nerve joins the ventral ramus C8 spinal nerve to form lower trunk of the brachial plexus. It gives no collateral or cutaneous branches. Second intercostal nerve. The lateral cutaneous branch of the second intercostal nerve is called the intercostobrachial nerve. It joins the medial cutaneous nerves of the arm and supplies the skin of the floor of the axilla and upper part of the medial side of arm. Seventh to 11th intercostal nerves. They are called the thoraco-abdominal nerves because these nerves, after leaving the corresponding intercostal space, pierce the diaphragm to enter into the abdominal wall. During their course in the thoracic region, they supply the intercostal muscles of respective spaces and also give sensory branches to the skin of the chest, diaphragm, and parietal pleura. During the abdominal course, they supply the muscles and the skin of the abdominal wall. Intercostal arteries. Each intercostal space contains one posterior and two anterior intercostal arteries. Posterior intercostal artery. There are 11 pair of posterior intercostal arteries, one in each space. Origin. The first and second posterior intercostal arteries are the branches of superior intercostal artery, a branch of the costocervical trunk. Third to 11th posterior intercostal arteries arise directly from the descending thoracic aorta. Course. The right posterior intercostal arteries are longer than the left because the descending aorta lies on the left side. Each posterior intercostal artery enters the posterior end of the intercostal space and travels forward. Lying above the nerve and below the vein in the neurovascular plane. At the costochondral junction, the main trunk of the posterior intercostal artery terminates by anastomosing with the upper anterior intercostal artery. Branches. Dorsal branch. Before entering the intercostal space, it gives off dorsal branch. It supplies the spinal cord, vertebra, and muscles and skin of back. Collateral branch. It arises near the angle of the rib. It runs parallel to the main artery along the upper border of the rib below the intercostal space and ends by anastomosing with the lower anterior intercostal space. Muscular branches supply the intercostal muscles and other muscles lying over the thoracic wall. Mammary branches. The second, third, fourth posterior intercostal arteries give branches to mammary gland. These are larger in females. Lateral cutaneous branch. It closely follows the lateral cutaneous branch of the intercostal nerve. It supplies skin over the thorax. Right bronchial artery arises from the right third posterior intercostal artery. Anterior intercostal artery. There are two anterior intercostal arteries in each space. They are present in upper 9 spaces only. The 10th and 11th spaces are very short and have open anterior ends. So, anterior intercostal arteries are absent in these spaces. Origin. The 1st to 6th anterior intercostal arteries are the branches of internal thoracic artery. 7th to 9th anterior intercostal arteries arise from musculophrenic artery. Course. The upper and lower anterior intercostal arteries pass laterally and backwards along the upper and lower margins of the respective spaces. The upper anterior intercostal artery anastomoses with the main trunk of the posterior intercostal artery at the costochondral junction, and the lower anterior intercostal artery anastomoses with the collateral branch at the same junction. Intercostal veins. Veins correspond to arteries and are arranged in 2 groups. Anterior intercostal veins and posterior intercostal veins. Anterior intercostal veins. They are present only in the upper 9 spaces. Each space contains 2 veins and accompanies the anterior intercostal arteries. The anterior intercostal veins of the upper 6 spaces drain into the internal thoracic vein, and those of the 7th, 8th, and 9th drain into the musculophrenic vein. Posterior intercostal veins. There are 11 posterior intercostal veins, 1 in each space. They accompany the posterior intercostal arteries. Its tributaries corresponds to the branches of the posterior intercostal artery. The mode of drainage of posterior intercostal veins differs on right and left sides. On the right side, first drains into right brachiocephalic vein. Second, third and fourth join to form right superior intercostal vein, which opens into azygous vein. 5th to 11th drain independently into azygous vein. On left side, first drains into left brachiocephalic vein. Second, third and fourth join to form left superior intercostal vein, which opens into left brachiocephalic vein. 5th to 8th drain independently into accessory azygous vein. Ninth to 11th drain into hemiazygous vein. Intercostal lymph nodes. Posterior intercostal lymph nodes, located in the posterior part of intercostal space near the neck of ribs. Anterior intercostal nodes lie along the course of the internal thoracic artery, hence called the internal thoracic nodes. Intercostal lymph vessels. Lymphatics from the anterior part of the spaces drain into anterior intercostal nodes. Lymphatics from the posterior part of the spaces drain into posterior intercostal nodes.